the Dental Insiders podcast, the industry's single source for the greatest news and industry insights from visionaries in the dental industry. Our guest today is none other than Dr. Luke Shuman.
This next question really is the next step, I guess, of that answer, or of the last question. So you're an authority on new technologies and you're an authority on practice management. And Matthew and I and all of us in the industry, we hear stories sometimes of dentists that go out, buy something at a trade show, and they never get around to learning how to use it. And so it ends up in their closet of stuff they don't use. And so, how does a busy dentist juggling, the need for education, as you mentioned, and juggling obviously the practice demands, how do they go about implementing a new technology without disrupting their office, the staff, patient flow, production, et cetera?
Yeah, I'm smiling because at my group practice, we used to have this operatory that wasn't plumbed, and that was for future growth. We used to call that the technology graveyard. My partner, he couldn't wait to go to Yankee. He would be like, the drool would be coming out of his lips, ripping the checks out because this was buying time.
Right.
And we would go, oh my God, what is he going to come back with this time? And we'd always peek over to look at the graveyard to see of years past what was brought into the practice that never got implemented. I actually do a 3-hour program on return on investment, and it relates to purchasing of technologies. But to break it down in just to a few sentences, the first key to implementing technology is recognizing the importance of your team. Because ultimately, your team takes the ownership around knowledge and implementation. Who's actually using that technology the most? And many times it's your team. So I feel that you need to bring your team into this decision process right from the beginning. You need to make sure that they are given the opportunity to learn, accept, acknowledge, and even understand why it's being integrated into the practice. And there needs to be a level of formal education. Be it with the rep, be it taking a day. So you're not trying to teach it while the practice is running. That's just not going to happen. So I've always felt, take the time, educate your whole team, do hands-on, and then one of the things I recommend is have a leader. Pick one team member who might, be really interested in that technology and have them be the owner. Have them be the person who interacts with the company, that finds about updates, that trains new team members. Who's going to train the new team member? So my opinion would be to give ownership to someone who's in charge of that technology in addition after that formal training begins. And I think you'll get a much greater understanding of its importance if the team embraces it, related to the ultimate integration of it, which is to benefit the patient. They need to understand that, to accept it and to recognize it, to learn it, and then to implement. So they can tell the patients, we just got this new technology and why it's for you, and this is why.
I think so often the team gets lost in these discussions.
Right. And
it's a big mistake.
Yeah, when we travel, and I notice a lot when I sit and talk to dentists on a lunch table or somewhere on a trade show floor, or even in their office if I'm working for a client doing a video or something, I always find that the practices that seem the most successful are the ones where the team is really tight and they're all working together. And even the ones, you see some doctors bring their whole staff to a trade show, like 7 people. And, at first you're like, that's got to cost a fortune. What's the purpose of that? But you realize that getting the team in, creating that sense of environment, getting everyone on the same page and feeling like we're all working together, boy, that just pays dividends through everything. And even what you're saying is through the implementation of technology, which we're in a technology boom right now, right, in dentistry in the last 10 years. Technology is just coming out faster and faster and faster, and it's changing the way practices run, right? It's changing workflow, it's changing ROI, it's changing patient experience, it's changing all those things. And I think the team is, you're right. The team is like the 7th leg tool that always just, we don't really need it, but so important. The good ones get it, and the ones that are struggling maybe don't get it, and it's a shift in the market.
And I have 2 words for that, and those 2 words are ownership mentality. The practitioner is in the operatory, and you can't do what I call knee-jerk management out of your operatory. Your team needs to have that understanding that they have ownership in that practice. They're given the ability to make decisions as if they were the owners, and so you need to make sure that that your team is empowered. They make or break the practice. They're the ones that have the relationships. I always say that, in one of my lectures I go, patients fall in love, and 95% of the time it's not with me, it's with the team. And so that the respect that they deserve, the experience that they have, you need to create an environment that they feel that, that they have the freedom to be able to utilize that experience and to recognize a situation where that, what would they do if they were in that situation, and have the confidence knowing that the practitioner allows them to make those decisions because they feel that's what's right for them and the patient and the practice. Totally agree with you.
Yeah, that reminds me of that also reminds me of the Nordstrom Employee Handbook. Have you ever seen the Nordstrom Employee Handbook?
I have. I actually have a lecture about one of my experiences with Nordstrom. I talk about there's the sort of the dual types of customer experiences I've had, and the Nordstrom one was unbelievable, and the Delta one was unbelievably horrible. And so when I'm presenting this tomorrow in Winnipeg, and to talk a little bit about the importance of customer service, because it's a lost art. It's no longer the rule, it's the exception. And I think as practices we need to focus on that importance, and to be that differentiator by focusing on customer service is a truly key element of our practice.
Yeah, it's kind of a lost art. And for those of you who don't know, the Nordstrom Employee Handbook is a postcard. It's a two-sided postcard, and the front says Nordstrom Employee Handbook, and you flip it over, and all it says on the back is use good judgment at all times. And that's the only rule.
There you go.
If you feel comfortable enough in empowering your team to live by that, you've got it made. And the trick is in the details of getting the right people, training them.
The leadership aspect, though, is critical in that, because you say being able to have to trust your employees to have that mindset and be able to use that postcard handbook.
Right. It
goes with the leadership, and it goes with the two words that were just mentioned earlier, ownership. Mentality.
Without a doubt. Yeah, we're kind of now in a dawn. Technology's big and has been big for 10 years, but I think we're now, what's emerging to me at least, and I think maybe you agree, is that service, whereas, a lot of people think they give great customer service because they just say, well, we'll just answer the phone quickly and we'll clean the bathroom real nice and we'll have good, we'll dress nice and have our logo on our scrubs, and that somehow is good customer service.
That's not good customer service?
It's the start of running a business is what it really is, but it has nothing to do with customer service. Customer service has to do with making that connection with the consumer to the point where they're no longer questioning,
right? Where they fall in love.
They fall in love, and so that's it. So it's a really, I think we're in a dawn of that service, that next level of service, and things requires a lot of work. And that's, if it were, I saw a speaker one time, and I can't remember who it was, but one of the things he said, if anything were easy, if something were easy, everyone would be doing it, right? If customer service,
that's right. It's hard work,
and it would be, everyone would be doing it. And the truth is, being the best at any one thing is only a small percentage of people want to achieve that, or want to do what it takes.
Or will put the work into it.
Right.
Right. And to sort of tie this in a bow, you're absolutely correct. You need to be committed to it. It's hard work, and the practices that really have it. I was working with a practice, and I was talking to some of their patients, and I asked them about the practice, and they gave that practice the ultimate compliment, and that was, we just like to come. Now, going to a dentist's office isn't, typically, a number one on the list, but the patients in the waiting room go, what we love about this practice, we just like to come. And for them to say that to me that's that ultimate focus, that they get it, that they recognize the importance of who they are and the service that's provided to them. So I think that's really cool.
I'm just curious, we talked about technology and we've talked about falling in love. So outside of dentistry, what technology have you fallen in love with?
That's easy, actually. The technology I've fallen in love with lately is OLED, organic LED. Organic LED was a technology that was developed by Kodak, and it was originally created for fighter jets that could be, you can curve the technology, so you know how the cockpits are curved, you could actually integrate it into a curved cockpit, and the level of brightness was amazing. And so LG, they got the exclusive license of organic LED for the television market. And an organic LED, an OLED TV by LG, is not just one generation ahead, it is literally 2 generations ahead of every single television that is sold on the market today. And so if anyone is, you know, if you want to talk about technology, I fall in love with it. My friends ask me all the time, because as I know that Matt knows, I have an audio and video background over the years. I tell them I got a call from a friend yesterday, and he said, I'm looking for a TV. I said, well, this is an easy conversation. I said, there's only one TV to buy, and that's the LG OLED, because it is truly 2 generations ahead of everything else. And one of the reasons why is plasmas, LEDs. The biggest difficulty or challenge with all of these technologies is real black, is to be able to show something that's real black. And the problem has been over time is that plasmas and LEDs, when you see something in black, the LED is only dimmed. So it's gray trying to get black. OLED is the only technology that that's been created as of today that when it goes black, the LED actually turns off. So it goes pure black. And so that, with its unbelievable contrast, and you should just go to a Magnolia or at a Best Buy and just look at the OLED. They only make 2 models, and it is truly an unbelievable technology. And they use OLED for other things, you know, like they're using it for MP3 players and different small sort of technology tools. But for something of impact, the TV industry, this technology is incredible. And I'm expecting them to license it to the other TV manufacturers at one point. But like I said, for Christmas, everybody, if you're looking for a TV, this is the only one to get. So there you go.
It's on my list.
I just wrote it down.
You did?
Yeah, and if you're looking at me, there's one right there.
It is. Okay.
I was going to ask, one behind you an OLED, so there you go.
There it is. That's correct.
Technology coming to like computer monitors, is it possible to then? So when you talk about the true black, I'm thinking right away in trying to tie this into dentistry. I'm thinking radiographs, like digital X-ray, that is a lot of black and white, and the clearer the image, the better the diagnosis. Whether we're talking about 3D or whether we're talking about 2D imaging, you see it coming to dentistry? OLED is already in dentistry as far as small screens to be able to see things that are in some of the products that are out there. It's a really difficult technology to work with. I know, I mean, to give you an idea, and I know, and Matt, don't laugh. So I got the first one. The first one that came out was actually by Sony. It was an 11-inch model. I could actually go back and pull it out. It's this big, and that was like 8 years ago. It was the first of its kind. It took literally years to take it from that size to the 55 and 65 inch that is now available. So I don't know how far it can be implemented based on the difficulty of implementing the technology, but it's already in some of the smaller products where at a small size it's easy to implement. But yeah, I think that we'll see more of it. I do. Yeah. Cool.
I do, especially once LG finally allows it to be utilized by other companies to start, playing with it and experimenting with it.